Hello, everyone. My name is Latisha Thompson, and I'm a graduate public health student in the University of Pennsylvania School of Medicine. Today, I will be speaking about our prospective mixed method study, not just a footnote, a healthcare system's critical response to patient social needs in the era of COVID-19. As affirmed by World Health Organization Chair Sir Michael Marmot, social determinants of health are not just a footnote, they are the main issue. These significant drivers affect the health outcomes of everyone, and they can either promote or constrain a person or community's capacity to be healthy. The associations between adverse social conditions, such as inadequate housing or low income, and poor health outcomes are well documented in the fields of public health. In 2019, Kaiser Permanente research found about a third of Americans are generally stressed about their social needs, leading to deleterious effects on population mental and physical well-being. And since the beginning of the pandemic, recent studies have suggested that these social risk factors may have even worsened. The CDC has found that in addition to fearing the virus itself, low-income households with children also experience concerns of employment, food security, healthcare access, and overall financial hardship. Yet, before and during the pandemic, U.S. health systems have been able to play a crucial role in answering that call by screening for unmet social needs, identifying a community resource, and connecting those who are in need. The University of Pennsylvania health system neighbors many zip codes of Philadelphia's highest concentrations of poverty, making local residents extremely vulnerable to COVID-19 infection, transmission, morbidity, and mortality. Since April 2020, our social needs response team, otherwise known as the SNRT, have addressed patient social needs in order to mitigate these compounding negative effects of the pandemic. Despite the broad implications of social needs screening and referral programs, there are few rigorous studies that evaluate these programs from a patient perspective, both during and before the pandemic. So with the use of semi-structured patient interviews and screening of patient chart data, our research team seeks to conduct a program evaluation of the effectiveness, acceptability, and feasibility of the SNRT to bridge this gap in the literature. Eligible participants are English and/or Spanish speakers who were screened and accepted assistance with their needs by our program between April 2020 and April 21. Patient-consented interviews will be available via phone or video using guided questions on the structure, process, and outcomes of the SNRT. Audio responses will be transcribed and coded by our research team members for thematic analysis. And lastly, we will gather and analyze descriptive statistics of patient data, including age, race, proximity to the poverty line, referral source, number of dependents, and number of social needs. Since the pandemic, we have received over 1,000 referrals and continue to serve some of the most historically marginalized groups, as noted in the present slide. Thus, our health systems clinicians, faculty, and students have a unique opportunity to improve population health and promote health equity in our community. This diagram depicts the intended timeline of our evaluation. With recent approval by Penn's IRB, we hope to begin patient recruitment and interviewing in the coming months, followed by transcription, coding, analysis of the interview data in the latter half of the summer for dissemination of results by the beginning of the fall semester. I'd like to take a moment to express my gratitude to my mentors, the Department of Social Work and Case Management, as well as the Center of Health Equity and Advancement at the University of Pennsylvania for their development of the SNRT, our student volunteers, as well as our community partners and organizations. Lastly, I'd like to thank you for your time and interest in our work towards greater health equity in the city of Philadelphia. For any feedback or inquiries, please do not hesitate to reach out to myself or Michelle at our respective contacts listed below. Thank you.